There's a white crystalline powder available at every pharmacy and hardware store in the world for $3 a bag. NASA includes magnesium supplementation protocols derived from this compound in its astronaut health maintenance programs. Because prolonged exposure to microgravity causes magnesium depletion that produces muscle failure, cardiac arrhythmia, and neurological dysfunction in otherwise healthy individuals. The United States military used it as a standard treatment for muscle injury and nerve damage in field hospitals across every major conflict from the First World War through Vietnam. The British National Health Service administers it intravenously to treat eclampsia, the life-threatening seizure condition affecting pregnant women, because no synthetic pharmaceutical compound has ever demonstrated superior efficacy for that specific clinical application. Agricultural researchers at the University of Alabama documented yield increases of over 20% in magnesium-deficient soil when this compound was applied at a cost of under $2 per treatment. Every commercial tomato grower in Florida uses it. Professional sports teams administer it to athletes after high-intensity training sessions. Hospitals stock it as an emergency cardiac medication. Anesthesiologists use it during surgery to prevent post-operative muscle cramping. Then, the $50 billion wellness industry calculated what a $3 bag that replaces magnesium supplements at $40 a month, muscle recovery products at $30 a bottle, prescription sleep aids at $80 a month, and commercial fertilizer at $60 a bag would do to their combined revenue. They did not suppress this knowledge because the compound was ineffective. They suppressed it because it was too effective, too cheap, and completely impossible to patent because it has been coming out of the ground in Epsom, Surrey, England since 1618. This is the story of magnesium sulfate, the compound that space agencies depend on, that military medicine trusted across a century of conflict, that agricultural science has validated for soil and crop applications, and that a $50 billion wellness industry spent decades ensuring you thought of exclusively as something for sore feet after a long day at work. If this knowledge matters to you, the subscribe button and the bell are the only way to protect it before this video disappears. This is where we open the vaults, the industry sealed shut. Stay right here, because by the time this video ends, I'm going to show you the exact transdermal absorption protocol that sports medicine practitioners use, and that the pharmacy label is not required to explain, the agricultural application method that commercial growers use to increase yields without expensive synthetic fertilizer programs, the sleep improvement mechanism that pharmaceutical sleep aid manufacturers have known about for decades, and specifically chose not to tell you, and the documented financial architecture that turned a $3 mineral compound into a fragmented $40 billion product category, selling you the same molecule at 50 times the cost in branded packaging. If you leave now, you will go back to paying $40 a month for magnesium glycinate capsules, $30 for a muscle recovery spray, $80 for a prescription sleep aid, and $60 for a bag of garden fertilizer. Every single one of those purchases delivers the same magnesium ion that a $3 bag has been delivering since a physician named Nehemiah Grew first documented the mineral spring at Epsom in 1695. Stay here. The whole story is coming. Let me take you back to where this begins. The year is 1618. A farmer in Epsom, Surrey, England, notices that his cattle refuse to drink from a specific well on his property despite being thirsty. He tastes the water himself and finds it intensely bitter. He brings the observation to local physicians who begin investigating the spring. Over the following decades, the bitter water from the Epsom spring becomes one of the most sought-after medicinal compounds in England. Physicians document that drinking it produces powerful purgative effects that clear constipation and reduce inflammation. Bathing in it relieves joint pain, muscle soreness, and skin conditions with a consistency that attracts patients from across England. By 1695, the physician Nehemiah Grew had isolated the active compound from Epsom spring water and identified it as a distinct mineral salt. He named it after its source, Epsom salt. The compound was magnesium sulfate, a naturally occurring mineral that dissolves completely in water and delivers magnesium ions directly to biological tissue through contact. Grew documented its purgative, anti-inflammatory, and muscle-relaxing properties with clinical precision that established it immediately as a mainstream medical compound across Europe. Within 50 years of Grew's isolation, magnesium sulfate was a standard compound in every European pharmacopoeia. Physicians prescribed it for constipation, inflammation, and muscle spasm across conditions now understood as symptoms of magnesium deficiency. The mechanism that makes magnesium sulfate so broadly effective across such a wide range of biological systems is rooted in magnesium's role in human physiology. Magnesium is required as a cofactor for over 300 enzymatic reactions in the human body. It regulates muscle contraction and relaxation at the cellular level by controlling calcium ion transport across muscle cell membranes. Without adequate magnesium, calcium floods muscle cells continuously, producing the sustained contraction states experienced as cramping, spasm, and tension. Magnesium is required for the synthesis of adenosine triphosphate, the energy currency of every cell in the body. It regulates neurotransmitter release at synaptic junctions throughout the nervous system. It controls the electrical conductivity of cardiac muscle cells that maintains normal heart rhythm. It participates directly in the synthesis of serotonin and melatonin, the neurotransmitters that govern mood stability and sleep onset. Approximately 75% of the American adult population consumes less magnesium than the recommended daily intake. Modern food processing strips magnesium from grains during refinement. Industrial agriculture has progressively depleted soil magnesium concentrations through synthetic fertilizer use that does not replace what crops remove. The result is a chronically magnesium deficient population experiencing muscle cramping, disrupted sleep, anxiety, fatigue, and cardiac irregularities, and paying the wellness industry $50 billion annually to treat those symptoms with products that deliver the same magnesium ion a $3 bag provides. During the First World War, field hospital physicians discovered that intravenous magnesium sulfate reduced traumatic muscle spasm and nerve damage from artillery blast exposure that standard analgesic compounds could not address. During the Second World War, Pacific Theater field medics used it to treat the cardiac and muscular complications of heat exhaustion in tropical environments. The magnesium depletion produced by extreme heat and physical exertion creates precisely the dysfunction that magnesium sulfate corrects. Astronauts in microgravity experience accelerated magnesium depletion through fluid redistribution and altered kidney function within days of entering weightlessness. The resulting cardiac arrhythmia, muscle weakness, and neurological effects that NASA flight surgeons identified as a primary health challenge in long-duration spaceflight confirmed what physicians had known since 1618. Magnesium is not a wellness supplement. It is a mineral the human body requires for fundamental physiological function, and the modern food system has systematically removed it from the average person's diet. The deficiency generates $50 billion annually in symptomatic treatment revenue for an industry that depends on it continuing. After the Second World War, the pharmaceutical and wellness industries adopted a fragmentation strategy. Rather than suppressing magnesium sulfate entirely, they created a proliferating ecosystem of magnesium-containing products in branded formats that obscured the connection to the $3 bag on the pharmacy shelf. Magnesium glycinate for sleep, magnesium citrate for digestion, magnesium threonate for cognitive function. Each formulation carried a retail price between $20 and $60 per month. A consumer paying $50 for magnesium threonate capsules was actively discouraged from connecting that purchase to the $3 bag in the foot care aisle. The agricultural suppression followed the same pattern. Magnesium deficiency in soil is one of the most common limiting factors in crop production globally, removed by every harvest and unreplaced by standard nitrogen, phosphorus, potassium fertilizer programs. The visual symptom, intervenal chlorosis, where leaves yellow between their veins, is one of the most commonly discussed plant health problems in gardening. The commercial solution sold for this problem is specialized foliar sprays at premium prices. The actual solution is magnesium sulfate dissolved in water at near zero cost per plant treatment from a $3 bag. Now here is exactly what magnesium sulfate does across its full range of applications at the level of mechanism that the pharmacy label and the gardening store display never explain together. Transdermal magnesium absorption through bathing in magnesium sulfate solution is the mechanism behind the clinical effectiveness of Epsom salt baths that physicians have documented for 4 centuries. The skin is permeable to magnesium ions in solution. A 2004 study conducted by Dr. Rosemary Waring at the University of Birmingham measured blood and urine magnesium levels before and after Epsom salt baths in human subjects, and confirmed statistically significant increases in both measurements following bathing, establishing that transdermal absorption of magnesium from magnesium sulfate solution is a real and measurable physiological phenomenon and not a placebo effect. The magnesium absorbed through the skin enters the bloodstream and tissues directly, bypassing the digestive absorption limitations that reduce the bioavailability of oral magnesium supplements. For muscle recovery, add 2 cups of magnesium sulfate granules to a warm bath and soak for at least 20 minutes. The transdermal magnesium absorption reduces the calcium-driven sustained muscle contraction that produces post-exercise soreness and cramping. The sulfate component supports the liver's phase 2 detoxification pathways that process the metabolic byproducts of intense physical exertion. Professional athletic trainers who understand what they are working with use this protocol after every high-intensity training session. The branded muscle recovery products that cost $30 a bottle frequently contain magnesium sulfate as an active ingredient alongside fragrance compounds and stabilizers that constitute the majority of the retail markup. For sleep improvement, take a 20-minute magnesium sulfate bath 1 hour before sleep. The transdermal magnesium absorption activates the parasympathetic nervous system response by reducing cortisol, slowing heart rate, and initiating the core temperature drop that triggers melatonin release. Magnesium is a required cofactor in the enzymatic conversion of a tryptophan to serotonin and serotonin to melatonin. In a deficient individual, this conversion is impaired regardless of tryptophan intake. The sleep disruption that results is not treated by pharmaceutical compounds that suppress the nervous system. It is addressed by providing the cofactor the process requires at a cost of $3. For garden and agricultural soil application, dissolve 1 tablespoon of magnesium sulfate in 1 gallon of water and apply as a foliar spray or soil drench to magnesium-deficient plants. Tomatoes, peppers, roses, and citrus are among the most magnesium-demanding crops and among the most commonly affected by magnesium deficiency in residential gardens. A single application of magnesium sulfate solution corrects intervenal chlorosis within 2 weeks and improves fruit set, fruit size, and overall plant vigor through the remainder of the growing season. The commercial foliar magnesium sprays sold at garden centers for $12 to $20 per bottle contain magnesium sulfate as their primary active ingredient alongside water, surfactants, and marketing. A $3 bag dissolved in water produces the identical active compound at 1% of the retail cost. For constipation relief, dissolve 2 teaspoons of magnesium sulfate in 8 ounces of water and drink on an empty stomach. The magnesium ions draw water into the intestinal lumen through osmotic action, softening stool and stimulating bowel motility within 30 minutes to 6 hours depending on individual response. This is the same mechanism that made Epsom spring water famous across England in the 17th century, and the same mechanism that the FDA has approved for magnesium sulfate as an over-the-counter laxative. The branded osmotic laxative products on pharmacy shelves frequently cost $8 to $15 for a quantity of active ingredient, equivalent to a fraction of a $3 bag. For foot care and skin conditions, dissolve half a cup of magnesium sulfate in a basin of warm water and soak feet for 20 minutes. The osmotic action reduces edema in swollen tissue. The magnesium absorption reduces the inflammatory signaling that produces foot pain. The sulfate compounds have a mild antimicrobial effect on surface skin bacteria. The commercial foot soak products marketed for the same applications contain magnesium sulfate as their primary active ingredient at retail prices that reach $15 to $20 per package. 1 $3 bag of magnesium sulfate handles muscle recovery, sleep improvement, garden soil magnesium correction, constipation relief, and foot and skin care. The branded products currently performing each of those applications separately carry a combined monthly household cost that exceeds $200 for the average American family actively managing any subset of those conditions. A physical therapist with 20 years of clinical practice wrote online that she had recommended Epsom salt baths to patients for post-injury muscle recovery throughout her career because the outcomes were consistent and the cost barrier was zero for patients who would otherwise abandon recovery protocols due to the expense of commercial products. The astronaut in low Earth orbit experiencing cardiac arrhythmia from magnesium depletion and the office worker lying awake at 3 a.m. with muscle cramps and racing thoughts are experiencing the same deficiency through different mechanisms. The NASA flight surgeon and the 17th century Epsom physician treating them are reaching for the same compound. The wellness industry that sits between that $3 bag and the person who needs what is inside it has built a $50 billion business on ensuring that connection is never clearly made. A white bag has been sitting on the pharmacy shelf the entire time, next to the foot care products, where the industry placed it to make sure you never looked at it as anything else. If this vault opened something for you today, subscribe and share this video immediately. Every share puts this knowledge in front of someone who will pay $40 this month for a magnesium supplement that costs $3 in the foot care aisle. Every subscription keeps this channel digging in the vaults they spent decades building walls around. The next vault opens soon, and what is buried inside is the one fire starting and heat retention method that indigenous communities in the coldest inhabited regions on Earth mastered thousands of years ago that cost nothing to implement, and that the outdoor equipment industry has spent 40 years making sure never appears in a single gear guide they did not profit from.